Do we want to have someone outside in case of others?
Well, good morning, everybody. I'm Grant Colfax, Director of Health for the City and County of San Francisco, and thank you for joining us today to talk about a most urgent crisis, the crisis of overdose deaths in San Francisco. This is also, unfortunately, a crisis across the state and across the United States, where last year nearly 120,000 people died due to overdose deaths, most of which were attributed to fentanyl. Last month, September, there were 54 accidental overdose deaths in San Francisco, according to the report released today by the San Francisco Office of the Chief Medical Examiner. This is a decrease over last year. In September 2022, we had 61 fatal overdoses. And once again, it's important to emphasize that these deaths still remain far too high. And unfortunately, even 54 overdose deaths, while we are thankful that those numbers are down compared to last year, that still represents nearly 2 people a day in San Francisco dying from mainly fentanyl-related overdose deaths. Fentanyl has been a game changer. It's unlike anything we've seen before, and we are focusing on strategies that we know can save lives and to make the most impact. We are consistently and continually launching new innovative approaches to address this challenge and expanding programs that we know work. We know that recovery is possible. We support people on that journey, on their road to recovery. And I, as an example, last week I did outreach in the Tenderloin with our newly formed night navigation team, which is staffed by Code Tenderloin, and you'll hear from them later today. In one night, walking the streets of the Tenderloin, we were able to help about a dozen people get into shelter and connected to care, including with case managers who are trained to place them in appropriate treatment and care programs and help them gain housing. This new program it builds on our growing street outreach teams and those efforts to, again, get people and support them in their recovery. And I can say, being on the streets with the team, it is just so inspiring to see the connections that are built, the trust that is engaged in, and the fact that people, if they're ready to go, to get services, to get shelter, to get treatment, the team really makes it happen. And that engagement and that trust building is so important as people are supported in their recovery. We have trained behavioral health clinicians, seasoned peer specialists, doctors, nurses, and health workers consistently present in neighborhoods working to bring unhoused individuals who use drugs into care and recovery. And care and treatment are accessible, and recovery is possible for every person. Addiction is a disease, but not one without a way out, and people need consistent support to be successful. We will continue to find innovative ways to provide this support, and we will continue to partner with our community-based organizations, including outstanding organizations like Code Tenderloin that are really doing the work so well on the ground. And we will continue to partner with the recovery community for guidance and build on the lived experience of many people who have been successful in overcoming addiction. And now here to tell you more about our new night navigation program is Donna Hilliard, Executive Director of Code Tenderloin, and who I had the pleasure of working with last week when we went out together, and I can tell you she just kills it. Thanks.
Thank you, Dr. Colfax, and it was a pleasure to be on the streets with you. It was really nice to see that people from the top office came down and really engaged with folks. So my name is Donna Hilliard. I am the Executive Director of Code Tenderloin. We will be embarking on our 3rd week of engagement in the Tenderloin South of Market neighborhood and under the new DPH Night Navigator program. We're really excited about this program because when this program came up, it was actually thought of from the residents in the TL community. And a lot of people don't know that, but this is a project that the community felt was needed, CBOs felt were needed. When the doors shut, we needed to have someone out there and on the streets and connecting with folks. So we're meeting a lot of people out there, and people want help. They're being very open. to what we have to say. That a lot of folks don't know about the resources that are available during the day, and so we're able to give them that knowledge. We are also transporting people to emergency rooms, overnight mental health clinics, respite, soma rise, and drug sobering centers. We've sheltered about 8+ people a night, and that's amazing. That's 8 people off of the street into a shelter where we know real treatment can start happening from there. So we are also passing out tons of naloxone and fentanyl strips, but also educating people on how to use the fentanyl strips properly. We think that that's an important piece to everything we do, is that education. And so my team and I treat everyone with dignity and respect, because we have all lived experience, and from addiction, from whatever type of recovery, we've all come from some type of addiction. But I myself have experience being homeless as a teenager, out on the streets at the age of 13, and I have 20 years plus in recovery. So I know personally that recovery does exist, recovery is possible, and it can happen. I'd like to introduce Elgin, who is the director of the Knights Navigator team, and he's spent 30 years in the TL community in several different capacities. As a drug dealer, as a drug advocate, I will say so many more things, but I won't go there. But he is the one that is going to be leading this Knights team and has done such a great job doing that. He also has a program which is called Fathers to Founders, where we are actually getting men who are on the street and embracing them, helping them get employment, but also helping them get mental health services that they need. We all know there's a stigma, especially when it comes to Black males. We're able to break that down by peer-to-peer support. So really what our team is out there doing is we are role models, because the team have all been there. Some folks just recently coming from the street, and some who have been in recovery for 20+ years. So knowing that someone cares is our special sauce and our power, that we're letting folks know that not only are we going to our jobs from 8 to 5, but guess what? We're out there from 7 p.m. to 3 a.m. with people. And inspiring hope, you can't do enough of that. And so really proud that we're here today to talk about this. Thank you.
Well, thank you so much, and again, thank you for your ongoing work and partnership. And I'd now like to ask Dr. Hillary Cunnins, our Director of Behavioral Health in San Francisco, to come up and say a few words.
Thanks so much, Dr. Colfax. Thanks, my Tenderloin colleagues, for your amazing work. Let me reiterate that 54 fatal overdoses were recorded in San Francisco last month in September. And while this is fewer than were recorded in August, a month when we saw 84 overdose deaths in San Francisco, we are on track to see an increase this year, 2023, compared to 2022. From January through September, the first 9 months of 2023, there have been a total of 620 accidental overdose deaths, according to preliminary data from the Office of the Chief Medical Examiner. As Dr. Colfax stated, we need to work and are working with other city departments, as well as our community members, to tackle the issues that fentanyl has unfortunately brought to our city. In collaboration with our partners at the Department of Homelessness and Supportive Housing, as well as community-based organizations, we have significantly grown our overdose prevention and behavioral health services in supportive housing over these last 2 years. We are working to embed overdose prevention into every city-funded housing site and have a growing team of health workers working directly in the supportive housing sites most impacted by overdose. These workers are providing medical and behavioral health care, overdose prevention, education support, and connections to ongoing treatment. Our Permanent Housing Advanced Clinical Services Team, or FACS, has been providing non-urgent in-home medical and behavioral health care since 2022. The program has now grown to serve 66 sites with 5,300 residents. And by the end of this calendar year, the team will be adding an additional 20 sites to its service roster. These health workers start and manage medication treatment for clients with opioid use disorder and link clients to ongoing mental health and substance use treatment where it is not available on site. Our pharmacy, that specializes in behavioral health services, makes regular buprenorphine deliveries. Buprenorphine is a medication, an effective medication for the treatment of opioid addiction. That pharmacy and pharmacists deliver to 26 permanent housing sites, and this program will continue to expand. Our Office of Overdose Prevention is working to coordinate all DPH parts and units providing services in permanent supportive housing to strengthen our work both internally in DPH as well as across city partners. We are working to help housing site operators maintain and manage their overdose education and prevention, including maintaining their own supply of naloxone, have worked with sites to install more than 100 public access boxes of naloxone for overdose emergencies in 17 of these sites. We regularly train residents and staff running sites on how to save a life from overdose. Finally, we have a critical team that engages overdose survivors within permanent supportive housing within 72 hours of an event, so that we can provide tailored and targeted support and education for survivors of overdose, importantly to give them the skills and knowledge and linkage to ongoing treatment and care. To talk more about this innovative program, the Home Overdose Prevention and Engagement, or HOPE program, I welcome to the podium the program manager, Dominique McDowell.
Thank you, Dr. Kunis. Thank you, Grant, Donna. Hello, my name is Dominique McDowell. I manage the HOPE program, which stands for Housed Outreach, Prevention, and Engagement. We're based out of the office, Ovid Clinic, which is the office-based induction clinic, which is a UCSF clinic. Like Donna, I also have lived experience with addiction for over 20 years. And whenever a house person experiences an overdose, we meet them out their door. You know, we get a list every morning from the SOAR team, which is the Street Overdose Response Team, which is the first responders. And we get a list every morning at 7 a.m. and we know where to go. We currently have 200 unique clients, which are housed, residents of supportive housing. And some of the words we always hear from, one of the words I heard from a former client is, I don't care what you have to offer, as long as I know that you care about me. And that's what he told me, it kind of hit home. We can't promise people the world, but if they do know that we care about them, that's a good start. That's a place to start from, the people that we care about them. Some people say they want treatment, like now, tomorrow, the next day. Whatever that request is by the participant, we try to fulfill it, whatever it is. Moving in this moment is the most important thing to the population. I think we have a raw of organizations and treatment programs that are trying to help this population of people that are suffering, you know, and that are lonely. We're just trying to give them back humanity. That's our main focus. We look beyond the disease of addiction and try to address the symptoms and the consequences, because people have dire consequences, you know, from addiction. Recently, I met a man who overdosed, and he had been using fentanyl for 15 years. And, you know, in his eyes, I could see the suffering and the hurt and the pain that he was going through. And all he asked me was, just help me. Just help me as I got to his door. You know, so it was lunchtime, when most clinicians aren't there. So I took him to the office, and I kind of induced my physician to stay for lunch and help him, which was an easy task for me to get them to stay. And this man continues to come back, we formed a group, you know, just a peer support group for people who had overdose, and he shows up, and he talks about it. We're not trying to enforce any type of policy, procedure on him. It's just come show up, and we just want to talk to you. We want to get to know you, get to know who you are. He's, you know, as anybody out there, he's having ups and downs, but he shows up, and that's what's important. And I think him showing up goes to what we do. You know, we show up, and we meet you there, and we go above and beyond for you. And that's why we do this work, you know, to help people. every human life is worth saving. That's our goal. You know, and our team is a psychiatrist, a social worker, navigators. And we go out, we hit the streets every day and try to help people. So, thank you.
Well, thank you. I want to thank our speakers and appreciate their telling the stories that are so important as we continue to support people in recovery. And we have a few minutes for some questions. Questions?
To those of you recovering with the challenges of addiction, was there something that helped you also bring to the table helping others, if that makes sense? If anybody's willing to share that.
Yeah, I'm happy to jump in here because I think it's really important that people don't realize just having someone that accepts you and not judges you helps you get to that next step in recovery. And for me, you know, I went through multiple different programs and showed up in different places, but at times felt like I was being judged and wasn't comfortable and didn't feel safe to open up. And when I finally found a place that was accepting of me, just as I came with all the baggage, I was able then to move forward and deal with the bigger issues. So.
And do you see that with clients now? With that experience, you can obviously help.
Absolutely. I mean, the biggest weapon we have against this is our stories and accepting people with openness and really just letting them know that, you know what, I was in the same place you're at, but you can actually get out of this. There's hope.
Thank you.
Thank you very much. We'll conclude the conference.